I would like to welcome Elizabeth Schlegel as our speaker today on the Lancet Commission article looking at health professions education in the next 10 years that was just published in the fall of 2022. So very timely. And I'm going to be the discussant. And as usual, we will have our Wendy Herman here, our librarian extraordinaire. I don't know how else to describe her, to contribute at the end. And I know we have Dr. Casera here, who's also going to contribute a little bit because of his role at CLI as Vice President of Interprofessional Education and Research of that nature. So Elizabeth, thank you for being here and look forward to the discussion.
Yeah, thank you very much, Alice, for your kind words. And again, it has been a wonderful, wonderful time with not only with you, but with all my friends, colleagues, and students / friends, colleagues who I have here on the panel. You are all experts. We are all experts in something and, opening our minds for new things. And I really feel this article, which is actually a sort of inventory of the past and as a future, also gives us a great synopsis about what has been in the past and where are we now and what have been prompted through COVID. So, and also I want to thank Wendy, of course, being always with us. So this is another great ride. So let's do a great journal club here. Awesome. Thanks again. Briefly of housekeeping, and I think Alice will have an eye on that. We ask all of you, please, to keep muted, unless speaking, of course. If you want to raise your hand, I can take your call, but we also will have 4 different questions where we ask you to contribute. So pretty much it will be facilitated by Alice, so we play it back and forth. But if you have a question, by all means, let me know so I can answer them ad hoc.
Yes, right. We will be using the chat as our base.
Thank you very much. Thank you very much for adding that. So there are really 4 learning objectives, and they're very interrelated. So we look at the key competencies of health professions education. Education as looked in the last decade. But what I also going to do is pretty much give you a synopsis about what happens. And we will discuss about this with the new innovations that might be coming on, in particular, talking about competency-based education, interprofessional-based education, and information technology facilitated education, which really came out of the entire pandemic. And we will look at the pandemic as a driver of change and also identify impacts of the pandemic about what happened to us and to our future and how can we leverage this going forward as a profession. Now, in this journal club, we talked mostly about the 2022 article from the Lancet, Challenges and Opportunities for Educating Health Professions. However, I also took a good look back for the last 10 years because this article really circles back a lot to what had been done in before. So before we start anything else, Alice wanted to ask you all a question, however. So at this point, and this is sort of like a blitz question, what are the most pressing challenges in health professions education that you see for the next 10 years forward coming around? And give us a really quick waterfall into the chat so we can see your thoughts on that.
We're doing this in the chat. So any ideas, throw out anything you think is a challenge that's for the next 10 years. I just put mine there to get you started. Mine's a pretty big one. Ben, thank you for that comment. Just want to let you know, short form content is called micro content for micro learning and using micro teaching. So 3 forms of micro.
Yeah, there was artificial intelligence. Yeah, this will be growth. Costs, exactly. Everything will be exploding with costs. That's a very good point. Yeah.
Sonia says transition back to in-person, right?
Right, right.
The cost of education is quite high. We know that.
Yes, promoting integration of education. Exactly. Yep, I agree with
Diversity
that.
and equity, great. Meeting student technology needs and learning styles. Thank you, Gina. That is an obligation. Oh, thank you. And Julie, I just saw you put something in. Let me see what I got here.
Yeah.
Assessment structures and supporting faculty to perform competency assessment.
Assessment.
Very
a good one,
relevant to
Julia.
this article.
Yeah, that's really very good.
You're really on target because a
Yeah.
big piece of this article is competency-based education.
Excellent. Yeah. Promoting NOAA culture of health professions education among educators, administrators. Yes, absolutely. And this will also cycle and circle back into this article that we have new professions, new career paths. So we really have to reinvent, not the wheel, but really come up with new solutions for everything. So if you guys are okay with that, let's promote and keep these ideas, because I will get back to that. And a lot of these ideas came out exactly of these articles. Fabulous. Okay, so then let's open the stage here. So before we talk about anything else, let me give you a little bit of the background. What was the thought structure about 10 years ago? And what people were concerned about was basically, there were a lot of solutions and they didn't fit the problem. And I love this sentence. This is an exact quote, and forgive me, but I have to hide the video panel because I don't see my screen. The global movements of people, pathogens, technologies, financing, information, yada, 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 is a problem and flows across national borders. It's exhilarating. Now, what I like here, by the way, this was in 2010, right? People and pathogens are just next to each other in one sentence, right? I like that. It couldn't be any better, right? But then, of course, it is acknowledged that people are not only the recipients of the services of healthcare, but also the co-producers of their own education and health. So in other words, this was really trying to kind of grasp this intense problem that we give healthcare, but everything is moving. It doesn't fit the problems. Healthcare is providing some services, but nothing is really catching up with the problems that we see on the planet. And what the Lancet Commission first did was really took an inventory and look at, well, what are the problems? What is there? What are the cornerstones of what we are actually talking about? And it sounds a little bit abstract, but I looked at the supplement, what they did, and pretty much they looked into the first thing in expenditure. How much does a doctor cost? How much education of a doctor cost? How much does education of a nurse cost? How much does a certain career path cost? How many nurses are there? How many doctors are there? So they really came from a very huge bird view and said, well, there is a lot of strains on the health system. Technology innovates, but nothing really goes in a certain direction, right? New microbes, people move, right? Population have different demands, things are changing, but we can't really grasp it, right? And professional differentiation goes, but it's not as differentiated as we see today. It was more in silos. It was more in the traditional ways as we saw it in the past. And to just give you a little bit of a rollback, so we had in 2010 the catastrophic earthquake in Haiti, right? We had movements, we had Ebola. For the first time, HIV started to grasp how the medications work and how we get them globally around. We also learned that midwives, nurses, all these other health professions were super important for getting anything done and helping us out. So that's why I have here the image of the doula looking at the baby. So a lot of things did really not work with how populations worked. And by the way, and I think this is a good example, after the Haiti earthquake, cholera moved in, right? About 10 months later. So we cannot really cross our eyes. Things are on the move and they were on the move and people didn't know what to do. So the Lancet Commission were really 20 experts that came together to come up with a vision and also to make sure that they break down the silos, right? Because the silos don't work anymore. The problems do not work with the solutions that were there. So they looked at the career paths and they said, well, currently, mostly what we see is doctors of nursing, public health, and others. So this is what we see. But more and more, there is healthcare out there of people who have a core education, such like the doulas or the midwives, but then they're integrated in a systematic teamwork. They're really part of the system, versus the nurses or the doctors are not. They're stuck in a hospital, and here they are. And then trans professions were moving in. These are administrators, budgeters, any other profession who aren't really able to touch a patient, but come up with policies, right? And then, of course, and they made a specific point here, community workers, and they were so important. If you really look, especially into low resource countries, they really helped out because most of the time, folks could not get to the doctors or the nurses, right, in the silos. So we saw overall it was a big problem that was looking for really creative solutions. Now, they also looked at the traditional model, and they could see, well, there was a curriculum, there were educational objectives, assessment, yada, yada, pretty much all that we teach today. But they also said, well, we really need to look at competencies. We need to measure the outcome in a competency way, because otherwise, what are we assessing, right? Knowledge doesn't help if it doesn't move the needle. So competency-based education started to come up in their ideas. But again, there was no strategy offered 10 years ago. It was more, okay, an inventory of what was there that might be able for a change. They also looked at the criteria for admissions because our healthcare professions did not represent the diversity of the patient population, right? So what can be done there? And they looked at creative models in low resource countries, for example, having a community send their own young people to medical school to get them back into their communities. So they looked at certain ways how to solve the problems. One of the problems were twinning, low resource country universities twinning, let's say, with Boston universities. I mean, I was part of that working for Harvard Medical School, in Vietnam and exchange curricula, right? So these were ways from a very high way to change the way education was delivered, with the hope that things might go better. But knowing learning really has to move things, and we have to look into learning. Equity is a big problem because it will be individually patient-centered, just it has to be individually learning-centered, right? But it has to be also population-based. And we cannot eclipse what the population is. It's not just amorph in an amorph way. No, there's equity, there's really problems. There was a lot of change that needed to happen. And of course, the interdependence in education. That means different types of workers had to collaborate together. Otherwise, we would have exactly the same silos. So overall, this was then what we ending up with the recommendations: change the instructional environment, change in the institutions, come up with a different leadership with enhanced investments to go into different directions, strengthen global learning. So it was absolutely understood that, you know, everybody has to chip in here with knowledge, right? And we have to make learning really active. We have to integrate learning in a certain way. But again, it was more an inventory, not a strategy at all. All right, great. So from here, fast forward, and I will ask you another question just in a moment. Fast forward, 2022. They started with the work for the 2022 paper in 2018. So this was just before COVID really hit. And they started to collect data. They started to look, well, what happened with our policies? What happened with the ideas that we came out? And the commission started to collect papers, and they looked at who quoted our paper first to begin with, right? But they started to look at the same parameters they had looked before. Numbers of graduations, what happened? And they said between 2008 and 2018, the numbers of doctors had doubled, but the numbers of nursing graduates had tripled, especially in high-income countries. So the nurses were now the majority of health professions in the workforce, okay, more than all the other professional groups combined, right? However, there was a brain drain from low-income to high-income countries. And I can't even tell you how many doctors I met in Vietnam who said, well, I go into being a waitress because there is no position for us. So people really emigrated, left, you know, they could not find a way. So internet-based collaboration also started to come up, education in healthcare. But I wanted to circle up here, and we have some specialties here in on our listener base who know quite a bit about nursing. So the next question that Alice and I came up with yesterday was really, well, what do you think? What might be the significance of the increase of the nursing graduates? What is this with the nurses? What are your thoughts, guys? And I'm, as being in awe of nurses in how much they leverage, I will say it is a flexible profession. And please disagree with me.
Mike,
is
do you
great.
want to comment at all as somebody who crosses both professions?
Right,
Mike has a major role
everybody
at the
really, yeah.
nursing school as well as the medical school. So
Right.
he's a perfect plant to help us think about this.
Yeah, no, I mean, I can't speak for nurses because I'm not a nurse in full transparency, but maybe an honorary one. But nevertheless, I put two thoughts. One thought was just something I was typing as you launched the question.
Yeah.
So maybe in terms of like, what is the increase in nurses? What does that mean? Well, I just would make the comment that nurses always come up as the most trusted profession. When you ask patients, who do they trust the most? And trust is a real big, important thing at this moment in the health professions, given everything that's happened and misinformation and diversity and everything that goes on that's been going on in the current world. So I just put that point out. The concept of that I just threw out in terms of nursing is that at least in the nursing world, in the brief small amount of literature I read, you had made a comment about practitioners who don't look the same, and I sort of use it as a general sort of thing that say that hey, in their values or their ideas or their culture or even their phenotype of what they look like and so forth, when healthcare providers can look like their patients or align with their patients in whatever that means, that usually patient outcomes are better. And so nursing has at least identified that for their profession, and they've had and I think other professions have also made that recognition. And so you see pipeline programs in the pre-health professions before people even get into the undergraduate or graduate programs that they're in, that they try to increase the diversity because the diversity is important. And as you go, and some of the research that I'm starting to embark upon at Northwell and at Hofstra is that as you go further in the trajectory, if you're an educator of health professions, and if you're a researcher in health professions, or if you're a faculty member of health professions, that divergence between the ultimate touch of the patient, who's the community that we serve, becomes more disparate because people can't climb upwards socially. So there's an equity problem and an inclusion problem.
All right, thank you very much, Mike. That was a great.
How do you feel about, oh, Kathy, you're here. I'm seeing you. Wonderful. I'm so glad to see you. So do you have any comments about this major increase that Elizabeth spoke about in nursing? Kathy being the dean of the nursing school. So I just looked at my screen and lit up. Thank you. And this influx of nurses and thinking about the future of health professions education across the board, which is what we're talking about today, in the next 10 years.
Right.
Which is so important. As I said, you weren't here for the intro, maybe, when I said for the younger people on the call, not as much for us, but what's happened in 10 years, Kathy?
So I think there's a number of different reasons why there's more nurses than, I think we're up to 4 million. One, there are various pathways to become a nurse. You can be an LPN. They're not registered nurses, but they're LPNs. They provide great care in the settings that they're in. There's the associate degree nurse. There's the baccalaureate nurse. If you want to talk about advanced practice nursing, you have the midwives, the nurse practitioners, the CRNAs, etc. And then there are, 1 or 2 hospital programs up in Western New York that actually graduates hospital-based schools for nurses. So there's multiple ways if somebody wants to be a nurse to get into nursing. And, in talking to a colleague of mine at the medical school, a female physician, she's like, when you become a physician, you go to medical school for one reason, right? To get into a good residency. You decide primary care, emergency medicine, etc. She said, once you've done your residency, you're pretty locked into that, unless you want to come through another residency. She said, for nursing, you can start out on med-surg, go into the ICU, come back out, go into cardiology, neonatal, et cetera. There are so many different pathways and opportunities for nursing. And nurses run the hospitals, when you think about it, right?
Yes.
Yeah,
Yes.
they run the
Yes,
hospitals.
they do. They do.
So
Yes.
there are a ton of opportunities for people.
Right.
And I think also, you know, the supply chain, supply and demand with physicians is managed tighter. Remember, there's a moratorium on medical schools for how many years? There was never a moratorium when it comes to nurses, right? And there's always federal grants for more nurses, et cetera, et cetera. So now I think somebody said nursing was more flexible than medicine. Well, I'm not
Yeah, that
quite,
was me.
yeah, I'm not quite sure about that. Maybe more flexible than medicine, but nursing right now nationally is in the throes of, they need to get out of the traditional way that people are educated, that nurses are educated, and to be more innovative and not be locked into that traditional academic model, to move to competency-based education, because as you said, knowledge is great, but it doesn't do anything for anybody. And evaluation tools need to be changed. The credit hour needs to be thrown out the window. There's so much change that needs to happen in nursing. And sometimes it's, you know, there's the generation that just doesn't want to change.
Okay. Wow,
Okay,
thank you. In the
great.
interest of time, I'm gonna move on, but thank you for this great synopsis. Thank you. That was really a great introduction. There was a hand up though briefly,
Oh,
Mike.
Yeah, I was just going to pose that question out, that I totally agree with what Dr. Gallo said, that's spot on in my experience as a non-nurse. But working with nurses and in nursing education, I would just throw out the idea also, I don't know if this is true, I suspect it's true in the what I've learned so far, the economics of education might divert or make it more likely that divert people that would otherwise be capable of other professions, but because of their own economics and their what I would call the social determinants of education, it diverts them away from the others because they just meet the facts of life. They need the paycheck, and you can possibly move faster in some of the alternative pathways that Dr. Gallo was talking about. That you can move faster through the trajectory and get out. And so you're a licensed professional working, let's say, as an associate nurse, and that was maybe what, and then get your bachelor's, and then even there, that's faster than the trajectory for any of these other professions that are pushing to the doctorate level.
Excellent. Thank you guys
Okay,
so
thanks.
much. So in the interest of
Continue.
time,
I think you should continue, Elizabeth,
I think I should continue. Absolutely. So let
because we
me.
haven't even gotten to the second article.
That is right, but this was the gist of where I wanted to get to. So let me share my screen again. Excellent. All right, so we come from the question, everybody. So again, we haven't hit COVID yet, right? When the Lancet Commission started to look again into papers, and they found over 2,000 papers that actually had cited the initial account. So they picked a random sample of 1,000 eligible papers, and probably Wendy could tell you all about that. And they themed them, right? This was a qualitative analysis, and they looked into these articles, and they found 3 key themes in 437 articles of these. Competency-based education, so just think what you just said. Interprofessional education, this was came up to 19%, and information technology facilitated education, which came up about 8.5%. So everything that you just said is very important and really goes for everybody. So let's look into this a little bit closer. Competency-based education. So there's really no surprise here. It is exactly as we define it, right? It's an observable ability, observable skill and attitude. We talk about the entrustable professional activities in the medical education. However, there were new competencies now. So there was an increased recognition of interprofessionalism and teamwork, because it was an important competence that really moved, that was really necessary for collaboration across multiple private, public, and community-based entities. Because when disaster hit, and remember, I showed you Haiti, right? Once disaster hits, once you have a problem, everybody needs to be able to chip in, right? and recognize the other person, but we will get to this just in a minute. Then another theme that was related now to competency-based, as a recognition and as tying it in as a neglected theme was health equity. And Alice had me highlighted yesterday, and absolutely right, because it is a neglected curricular theme. And substantial health disparities is across the board. It's everywhere. We have to see this. It's among population, subgroups, and we see it in urban, rural residents, race, ethnicity, across the board, everywhere. So competency-based education, it actually expanded in the scope, and it started to include more interprofessional, but also more sensitivity towards the needs of our populations. And this was nearly a quarter of all the themes that came up. So the next was interprofessional, so I have to move. Interprofessional education, which came up to 19%, which means it encourages collaboration with multiple healthcare related disciplines. And one of the definitions, but there are more out there, where two or more professions learn with, from, and about each other to improve collaboration and quality of care. Because again, it was absolutely seen that there is a need for efficient multidisciplinary collaboration to meet the increasingly complex healthcare needs of population. And remember, one of the first things I quoted was, people are moving, pathogens are moving, disasters are hitting, right? It's getting more complex on our planet. Again, what they talked about here was still mostly nurses and doctors in a clinical setting. So it didn't come up yet, right? That this has to go on a global scale, but still, this was before COVID, right? They also said, well, students really need to go into the community and learn and see what's out there. They have to go in rural areas. They have to go into authentic real world settings to learn how medicine really works. So these were quite a bit of papers that will also come up here. And of course, and because this was my job, right? Or is still my job for the next 3 weeks, faculty development, right? Because you cannot just assume that people play nicely together. They really need to learn how to do this, right? And what to watch out for. So faculty development was another big theme. And now we go to theme number 3, which was, oh, no, before we go here, this is a slide that I thankfully borrowed from one of my doctoral candidates, Terry Cooper, who is here also on the call. Once you do interprofessional collaboration, you also have to think about identity development. And this is something that we preach in faculty development all along. As a teacher, as a professional, you have to develop your identity. However, once you work with different professions together, identity will shift, right? And you have to be open to develop another identity. And what we talk about here is what we call dual identity development. That means it's not just your own uniprofessional identity, me as a doctor, me as a nurse, me as a health professions educator. No. I have to break down my own barriers of assumptions. I have to open myself up and learn and see what has the other profession to offer that I can make room for to really collaborate and really get the most value to serve the people in need. So this is what we talk about, dual identity development. And this paper of Khalili and Orchard was actually quoted in the Lancet article here. So I want to point this out, which is a very important point, that while we know about that, we also have to really work on our idea of identity in order to really make this happen. And here's question number 3 that Alice and I crafted together yesterday. So based on our role in either undergraduate medical education or beyond undergraduate medical education or nursing, what efforts are supporting interprofessional socialization? And how are we developing seasoned faculty to role model interprofessional socialization? So I think this is a really hard one, but let me know your thoughts. We want to learn together here. And I stop sharing my screen.
So what are people thinking? And I know we have people not in medical education. You can comment as well. That if you're working in a different area, how are you developing that interprofessional socialization in your areas? Because I think that's the key to the success of this mantra. We could say, I can tell you from my past life as a nutritionist, I would work with students and we would think it's interprofessional nutrition with physicians or nurses or social workers, whoever they were working with, but they were working in a silo. The only thing, they weren't working together. They had overlapping patients, they had overlapping issues, but they were still siloed. They were not doing interprofessional socialization, complex problem solving together. That's what they need to be doing. And I think that how to do this, the faculty who are the role models for our learners have to role model this as well. They can't be in a silo saying, okay, I'm doing this for the patient and I'll get the social worker to do this, or I'll get the nurse to do this, or I'll get the nutritionist to do this. It has to be together. You know, I do a lot of work in ethics, and it's a real team collaborative approach, I must say. Let's see what's happening in the chat. Ben Thomas, who's my new friend from CLI, what is he saying? So you need to start with the onboarding process. It has to start with onboarding, and our onboarding many times are siloed.
Right. That really speaks that the onboarding process should be a workshop where people
Right.
really exchange, you know, I mean, we have movies, right? We put quite a bit of effort into onboarding.
Can I share some thoughts?
Go ahead.
Yes.
Of course, Nehal, join us.
So, hi everyone. Actually, I've been doing some work on IPE, and I want to share some views which we are going to be presenting in the American College of Surgeons IPE workshop in March. So I'm trying to look on the problem of IPE from a more holistic approach. So I think we need to have a clear framework for integration of IPE into training programs. And the second thing is that we usually try to get people together regardless of the degree of preparedness of each institution to get into the IPE process. One nice model is from British Columbia, which I usually use because it has a complete framework where you start first with self-identification and identifying more of your professional identity, shadowing to see what others are doing, and then progressing to some sort of demonstration and immersion at the simulation level before getting into the workplace with different types of teaching and learning methods along the spectrum. The other thing is that there is categorization for the different health profession education institutes into 3 levels. So for the first category, this is the one where most of the institutions would have and would be sufficient for the basic level of IPE. Next, there is an emerging level, and the third one is the mastery level. And there are clear criteria for each of these. And the nice is that we are having tools now where you can assess where along the spectrum is your institute. So my vision for this is that at a strategic level, there should be some sort of a current situation analysis and needs assessment, where, for instance, I can look into my College of Nursing, my College of Medicine, my College of Applied Health, etc. Where along the spectrum does each of these lie? So that when I'm planning some sort of activities, I'm planning them in view of the resources that are available at each of these institutes. The other thing is that if we're having tools to diagnose our preparedness for IPE, this would be helpful because it might get you the data you're looking for, like for the environmental needs assessment, which is an important step in the general needs assessment for any new curriculum. So if you've got those tools, if you're applying them, it won't only tell you where along the spectrum are you, or what are you prepared to integrate, but it would tell you, give you some sort of steps to go forward, some sort of resources for planning. Where do I want to reach? How can I reach there? In with Professor Fornari, we're in the retreat for the master's students. We're going to have in the IPE session, I'm delivering one with Barbara Devu. we're going to have
Barbara
them
DeVoe, who's
assess.
a nurse, so she's not presenting without another professional.
So we're having an interprofessional team presenting, and we have prepared a survey so that you can assess the level of your institution preparedness for IPE, what types of activities can get in. So I'm very much into this holistic view into IPE, so that you're not looking onto an abstract perils, challenges. It's some sort of more of informed decision-making towards effective IPE collaboration and practice. Sorry if
Thank
this was
you.
lengthy.
Thank you. No, I really appreciate it. Thank you very much. It sounded very strategic and really ready to act. So if I
really,
need to
we're
learn more, I
doing-
will definitely.
Yeah, this is
Sorry.
a very important topic. That's why I put it into the retreat, and I made sure that I had a physician and a nurse presenting it together. So you can't really talk about IPA effectively if you don't have representation of professions. But Elizabeth, you should continue because time is tight.
Thank you very much for the reminder. Absolutely. But it's as usual, it's really, so I hope you can see. Yeah, it's always the audience who are the experts.
Next.
Okay. So the next is then information technology facilitated education. I just wanted to make an educated stop there and go for our IP. And now, and remember, this is still prior to COVID. We recognize there are new approaches, but everything is very big data based. Big data, augmented reality, second life, mixed reality, simulation, artificial intelligence. So it was recognized that these things are on the horizon and they are used, but it did not filter down in the hand of individual educators yet. It was recognized there was knowledge management necessary, right? It was recognized when people had smartphones and they were able to look stuff up rather than remember them. Pedagogic changes were recognized, so there was hybrid, fully online learning, distance outreach, so there was video streaming, podcast, videocasts, and simulation and artificial intelligence. So this came up on the horizon and was kind of ready to be done, but not yet very nimble and very flexible. And then it happened. You all know what happened. COVID hit. And Alice, in the interest of time, I
Yeah,
might
let's,
skip
right,
that
let's skip
question.
this question because
So-
we just did a question. Go ahead.
COVID hit, and what happened? And the Lancet Commission went ahead and basically looked at all this different data now in the light of as the pandemic washed over every one of us. They surveyed 67 schools of medicine and nursing internationally. They looked at best practices in medical education guides and a collection of academic medicine articles. And they looked at the themes back, circling to the initial Lancet 2010 articles. That's why I gave you so much introduction on that. They looked into criteria of admissions because they knew what had changed. Things are very out of whack. How did this play out? They looked again into competencies, methods of teaching, and they looked now into career pathways. So let me give you a very colorful synopsis. If this is a lot to read, let me tell you the story of the slide. So now it was recognized that information technology facilitated education was a thing. It came into individual classrooms. I also can share with you that learning sciences was now on the horizon. Cognitive sciences was now on the horizon. These were theories that had never been up before, not in the other Lancet articles. It was really cool. Interprofessional education and competency-based education merges. So the silos really came together, and it was expected to be able to know how Zoom works. It was expected to know how flipped classroom works. Instructional design, all these different entities, they came up because learning had to be faster and it had to be very effective. Now, unexpected opportunities to educational innovations were suddenly here. And the individual educator, the individual student was also invited to come up with innovations and even to publish them. So the systems kind of, well, they didn't really break down, but they overlapped. They opened themselves up to the individual to excel. So institutions should not just come up to a new way, but they really should come up with improved ways. So we are looking at renewed educational technologies. A lot of ideas were actually from the 2006s, a lot of theories were actually not that new, but they were renewed. And now we had all these different tools on the horizon. If you remember, we have a radio show, well said, right? So this was on the horizon. Alice's app was developed. This is now on the horizon. Podcasts, my blog is now on the horizon. So all these different opportunities now were absolutely accepted and used as methods of learning. And last but not least, innovative publication formats were out there. So if you got engaged in all these different things, you had an outlet here to publish on. So in a nutshell, this is how the pandemic drove everything. And we came up with a new set of post-COVID competencies, which means that all the things that we just mentioned before, they are expected of you. This is really professional development, collaborative teamwork, intercultural collaboration, right? So these were integrated competencies. It was expected of you. They were still the specialized competencies, but they opened up for the skills for the other professions. And it was expected of you to know the theories, the concepts, the facts, right? So people went back on their knowledge, and cognitive learning theories, adult learning theories, they all came to the forward, and now they are expected of you. And to be quite honest, they also really helped. And last but not least, and I love it, and this is something that I'm always proposing, education for life. It is all in your hands. There are new technologies, there are new ways to do this. Get busy and find out how can every student, how can every profession, every one of us really learn what is necessary to keep learning throughout of life, because the facts alone are too much. But we can take absolutely the rein in our own professions. We absolutely can come up with our own career paths. And it was also recognized that we are all individuals learning to live our own healthy lives, integrating collaboration and living with the rest of us in an overall education for life paradigm. And with this, yes.
So someone said that is commenting, I love the idea of education for life. And Helena, thank you for being here. It's great to see you. I think this is something, if we could achieve as educators, that people feel they're going to educate themselves for life. I certainly feel this way in the way I lead my life currently, is there's something new to learn all the time. And people sometimes say, when do you stop? I don't feel there is a stop. There's no reason to stop. Why would we stop? And I just want to ask Mike, this slide here where it says new educational technologies and transformation of health systems. In your role in technology, because you do head up, there's medical director, the SIM Center at CLI, BioSkills, the Clinical Skills Center, all that stuff. What are you thinking in terms of transforming of health systems going from 2010, 2022 in the next 10 years? What are you thinking?
Yeah, there were a couple of things, and I was typing some of that. I mean, this is a disruptive innovation moment. I guess maybe the quick thought, if I'll just put it out quickly, is that if we're trying, there's going to be a lot of merging, a lot of lumping together of different things. And so if you're going to do education, we all share the same patients. So then there's like lots of different culture, mindsets, and maybe like attitudes towards, practices and methods that we already have. That I think would have to change. And then the transformation in terms of the technology part is just that innovation is happening, and then will continue to happen. So in some ways it'll make it easier. So the fact that we don't have to come together, or that we can learn independently, individually, asynchronously or synchronously offline, but then come together, we'll always have to come together in teams. So you never want to lose the teams. But so the technologies are becoming more and more available to support that. The culture piece is always, and the mindset of how do we integrate the system and the players and the stakeholders within the system to encourage the diversity of learners and diversity of practices and all of that, so that we can have equitable distribution of education. That's what has to also accompany the technological advancements. So I think about the transformation of health systems. For example, we're doing curriculum renewal at our School of Medicine. I would sort of say, wow, that curriculum renewal should also touch the academic practice partner, the health system, and it does. And it should touch the School of Nursing. It should touch the PA program and all the other health professions. And then health professions share patients with non-health professions like engineers and stuff. So I think about it in a very big, high-level way. And so I don't want to get lost.
Yeah, I think that's interesting talking about engineering, because with certain of this technology requires a re-engineering of systems at the systems level for sure. Elizabeth, what's your next slide, just out of time? I'm looking at
No, we're good. We're good. So this is my culminating last slide, and then I want to give you the summary.
So-
Can I add a comment?
Yes,
Absolutely.
Thank you. So I think that the more we're getting into this disruption and the more that the medical education, health profession education problems are getting more complex, I think this is a time for a new mindset. So I would focus on our health profession educators and learners getting subjected to new ways of looking into problems. And I would suggest something that I have tried and have presented in multiple grand rounds and worked really good, which is adaptation of the design thinking model, like the one from Stanford University, for solving complex medical education problems. This is the time to look into other disciplines. Business is one candidate, and try to adapt these models and have this mindset of empathizing with the needs of the different stakeholders, getting deeply into innovation and creativity and an evidence-based approach for solving problems. So I think that we need a mindset shift and to integrate the problem solving for complex healthcare problems into the minds of educators and learners. Thank
I
you.
just want to tell you, it's funny, you planted a seed because the May Journal Club is, I just sat with Ben Thomas, my new friend that I met from CLI, and he and I will be doing a journal club on innovation and design thinking using 2 Harvard Business Review articles in May. And I recruited Ben on last week, and I met him last week and recruited him last week. So I'm very excited that you brought that up. Do you want to have Wendy comment on this article and the type of press that it got?
All right. So
You want to move forward to Wendy's slide?
let me move forward to Wendy's
Right here.
slide. Yes.
Perfect.
Wendy,
Thank you so
you're
much.
on.
So I'll be rather quick about this. So the bibliometric data for this particular article, which was pulled from Scopus, as you can see here, there are only 2 articles that cited this particular article back, but that's actually not unusual given that it was published in late 2022. And also any kind of educational innovations would be kind of a long-term process. So I can't imagine it being immediately cited back, not even a full year after it was published. What I want to direct everyone's attention to, however, is the number of captures of Mendeley as well as the social media discussions. This to me indicates that there's a lot of discussion being had about this article, which I think is crucial. And the fact that this article was saved 39 times just within the program of Mendeley, which is a bibliographic citation management software, indicates to me that people are talking, people are saving and considering this article for future cite backs. If you're interested in the 2 articles that have cited this article back so far, it's on the right-hand side, one called Plugging the Medical Brain Drain and Challenges and Opportunities in Interprofessional Education and Practice. Thank you.
What about the tweets, Wendy?
Yeah, so with this particular platform, unfortunately, they didn't quantify the number of followers, unfortunately, and there was no altmetric page available at the time, or even now, there's no altmetric page available, but there were 80 tweets that were produced, and also sharing on social media platforms such as Facebook was captured, which were about 50 shares. A lot of the conversations from what I browsed through, at least on Twitter, is that it wasn't just a lot of retweets, although there were a lot of retweets, but there were a lot of commentary on the importance of this particular article, which oftentimes what happens with Twitter is that you'll do a lot of retweets and not so much depth on what you think about certain that particular item. But a lot of people were in agreement, and they had actually commented about the article itself, which was promising. Once again, kind of fueling the idea that people are having conversations about the content of the article.
Yes, I want to say something. This is a very dense article to get through. It's not the type article that's easy to read, I must say. I was very happy I heard the keynote speaker, who was the first author on the article, speak at a conference and dissect the article for me. And when I recommend it to people, which I have, I say, please look at the tables. The tables are really informative in this article. So they have nice tables in the article. Julio Frank, who is the lead author of this article, is at University of Miami. He's president of University of Miami.
Mhm.
And fabulous speaker, was a great keynote speaker to summarize what this article is presenting. So nice opportunity. Okay, back to the slide deck. Thank you, Wendy.
You're welcome.
And as you say, this is not going to be an easy read article that people will just pick up and throw into something. Right, and Mike picked up on the figures in the article.
Yeah, yeah.
So-
No, but
Any last thoughts on this article and this concept of what we need to be thinking about? So we have 3 summaries of it, if I'm not mistaken. I'll do a teach back and see if I got it. So I have competency-based medical education, interprofessional
Mhm.
education, and of course, technology coming forward in different formats. So if anybody's thinking about curriculum review like we are, this seems to be a big hot button topic. And people putting some things in the chat.
yeah,
Yes, we need to adapt and embrace change.
yeah, it is very important. And I really appreciate how the perspective shifted from overall institution. Now it goes to thinking, it goes to cognitive science, it goes to learning science, it goes to education. So this is really something that's actionable, that's not on a big number out there. Nobody really knows how to do this. So I felt it really got more actionable, but also COVID was probably a big catalyzer in really focusing down how to put really things to get going, how to teach, how to collaborate, how to do this. So it really got us into the direction of problem solving.
Could you put the last slide up, please?
So I think the last would be the appendix,
No,
because
Oh, we
done
didn't put
what
the slide
I
in.
had.
I'm sorry, we didn't put the slide, Wendy, with,
It should be the very last one. I thought I put it
guess
into the chat.
That is Wendy's slide, so.
Oh, okay.
Okay, so-
I can put the link, however, into the chat box. So let me grab that up and
so
I'll.
the
Okay.
next journal club is going to be on February
Oh.
2nd, which would be the announcement, as well as the link to evaluate this journal club. You will get a
Gotcha.
copy of the PowerPoint. You got the articles when you registered. You will get the PowerPoint and you will get a SurveyMonkey link to evaluate this, plus Wendy put it in the chat, so thank you.
Yeah.
And the next journal club is February 7th, thank you. And I'm going to be going over something that I think is quite exciting. The new clinician educator milestones that are coming out of the ACGME. And saying that clinician educators, not only trainees have to meet milestones, clinician educators should. This is not a mandate, this is not a requirement, it's a should. And I'm going to be reviewing the pathways for professional development and framework for these new milestones that were beta tested and now they're out in publication. So pretty exciting topic. To see a national organization. Actually, it was, I think, 4 national organizations worked together to make these milestones. 4, not just 1. So I want to thank everybody for joining today. Important topic, even though it's a little dense. And thank you, Wendy, for as always for being here with us and helping. And I look forward to seeing you on future dates. Spread the word.
Yeah, thank you very much for joining us. Thank you very much for contributing, and stay in touch.
Okay, I'll stop the